Hi everybody, Dr. Kaylee here, owner and founder of the Hope Doctors Pelvic Floor Physical Therapy in St. Petersburg, Florida. Super excited to answer this question for you. We did a little bit of a shorts on it last week on how to know kind of if you have a tight pelvic floor, if you have a weak pelvic floor. And I wanted to go into a longer video to detail this a little bit more specifically for you because it can bring up questions and give us some insight into kind of what's going on, but it's helpful to understand the behind the scenes and really what we're looking for. So before we talk about exactly how to know whether your pelvic floor is tight or weak or what exactly we're looking for, I'd like to describe or define those terms. So like tightness is going to refer to a muscle that has a lot of trouble being able to be in what's like a neutral state. So like it's a little more contracted than we want it to be. Doesn't mean it's always super contracted. It also doesn't mean that it's fully relaxed. That's not a tight muscle. A tight muscle is more so it's semi-contracted through some range, and then it typically has trouble lengthening or opening up into the rest of that range of motion. I always like to think of my upper traps because that's just where I hold all my stress, and there's a lot of tension, a lot of tightness in those muscles for me. And so when you think about it, if I have tightness here, instead of being able to fully keep my shoulders down without having any tension, the tightness, the muscles are going to activate and pull them up a little bit. It shortens that range of motion. So then it doesn't feel great when I have to pull them down actively because they are a tight muscle. And so that tightness is contributing to symptoms typically. And then if you're thinking about tightness, we always think in our brain, it's kind of a natural thing, something that I communicate with clients about all the time is that tightness must mean I'm super strong. And the answer is no, that is not what that means. It does not always mean that you're super strong. It often actually means tightness is weakness, right? So it's tough because again, we wanted to determine what exactly is the problem, but I often find that a tight pelvic floor is also a weak pelvic floor. But a weak pelvic floor is not always a tight pelvic floor. And so remember those two kinds of things because that can be a really important factor to kind of determine how you want to move forward with treatment or how your practitioner should move forward with treatment. So now that we've kind of defined tight pelvic floor, what that might look like and explaining that, let's talk about a weak pelvic floor. So a weak pelvic floor or a weak muscle, very similar to how we would determine if you have a weak quad or a weak bicep or a weak muscle in general, is that it doesn't contract to the amount of force that we need it to contract to. So for example, if you have weakness, you have a really hard time contracting fully against pressure, against weight, against resistance. Typically we consider that weakness, right? Also functionally it can mean you're having trouble doing things like getting out of a chair, getting off the toilet, getting out of bed, different things like that. So weakness is the opposite of strength. So strength would be the ability to do all of those things, add resistance, have no issue, whereas weakness would be a struggle with doing that. The way as a physical therapist that we determine strength is two ways. One is functional movement. So we're gonna look at you do certain movements. We're gonna watch you do certain movements. Really important that we watch it specifically because we can clarify where the weakness might be coming from. Is there a compensation that you're experiencing? Is another muscle stronger than one that's also making a motion happen, which is therefore making it look weak? Lots of things we're looking there. The second way is we actually manually will test, and this is just in general with any muscle. We will assess holding pressure. Can you push against me? What happens? What's the breaking point? In physical therapy, we go through kind of a stage of a 0 to 5. A 0 is you can't actually resist at all. I can push you down. There is no strength happening, no muscle contraction happening. A 1, very little, but I still can overpower you very easily. There's just not a lot of resistance. A 2 is we're getting there. I can still overpower you pretty well, but we're getting there. A 3 is a little bit more in the middle where you can hold it pretty well and you're holding that resistance, meeting my resistance. A 4 is you're adding a little more towards me, but you can't bring me to my breaking point yet. And a 5 is you're much stronger than I am. And we test each muscle specifically based on which position you're in, whether or not we want to add manual resistance or a band resistance or weight resistance. And we're trained on being able to determine, is that a weakness based on your other side? So we have to test all sides. Or is it a weakness based on what the norm is for your body? And so I am a big fan of doing this more so comparing side by side for the person, because I feel like there's so much opportunity for error if I test and then another physical therapist comes in and tests. And so just a personal preference of the Hope doctors. We determine that based on our own scale. A lot of practitioners practice that way. But let's move into the pelvic floor and how we would do an assessment to determine if there's tightness or weakness. So as you know, a pelvic floor assessment, especially with a pelvic floor therapist, is going to be an internal vaginal examination, possibly an internal rectal examination. We are going to put gloves on, lubricant. We are going to insert our finger into the vaginal canal, into the rectal canal to do this assessment to find the muscles in the pelvic floor. We are doing a visual assessment as well externally where nothing is being inserted. We're doing assessments of the glute muscles, the adductors, the core. We're checking everything on the outside first and then we will get to the pelvic exam if you give us your consent. Very important that you give consent to a practitioner to do a pelvic exam. If you do not give your consent and the practitioner still tries to force it on you, find a new practitioner. There are so many layers to doing a pelvic exam. We never want you to feel uncomfortable. So just keep that in mind. You can always say no or ask for it to come later on. So when we do this exam, we're going in first, checking for, and the way that I practice is I'm honestly just checking for resting position first. I can clarify if the muscle is tight just by doing this portion. So I will go in, I will add quite a bit of pressure to different areas of the pelvic floor. You have a superficial layer, which is kind of closer to the opening, and then you have a deep layer, which is up higher up in the canal. I'm adding pressure to see, are you resisting? Is there pain? Does it feel tight? Ultimately, the muscle should kind of like be able to give. I should be able to press into it. You shouldn't have any symptoms. It doesn't feel great because it's in the vagina or the rectum, but you shouldn't have symptoms. It should just feel kind of like a regular muscle. If you're in a resting tone and you have activation in that muscle, it won't feel great, and I get a lot of resistance just trying to put pressure in the muscle. So I'm making note of that. We're having some tightness. This is what I'm noticing. Where is it happening? And then our goal is to obviously find the root cause, or why is it tight? Because it's not always just because the pelvic floor is tight. It could be rib cage, foot function, jaw function, all kinds of other things. That's outside the point of this video. But so tightness again is there. We talk about coordination a lot. I ask you to take a deep breath down. Can you reach the pelvic floor with your breath? Are you able to breathe down into the vaginal opening, the rectal opening, and feel length in the pelvic floor? If not, we're leaning towards having more tightness in the pelvic floor. That also kind of correlates to constipation, pelvic pain, difficulty urinating, all kinds of other symptoms that we might notice, right? We see it a lot in the back wall post like a vaginal delivery, not on the bladder side, but on the rectal side. We'll see like those muscles in the back being really tight. And again, can be tender, may not be tender, but it might be resisting us as we add pressure. And then we go into the weakness. Couple of ways that we're testing for muscle weakness in the pelvic floor. We're asking you to contract, we're asking you to relax. First, does that work? Are we able to get the cue when we ask you to do it? Is the muscle fully contracting around the finger? Is it letting go fully? That's coordination. So we're making a note of that. Do we get the signals appropriately? And then we're moving into, can you squeeze my finger really well? So thinking, do I feel the muscles of the vagina all the way around my finger? Are all of the muscles turning on as they should to make that contraction happen? So that's the second piece. And then we're working on, can you squeeze and hold? Can you do fast squeeze let goes? We're testing coordination there. So when you squeeze your pelvic floor, let it go, what am I feeling around my finger? And then from there, we're gonna do what's called kind of elevators. We wanna go from like a fully relaxed pelvic floor. Can you squeeze up a little bit, halfway, a little more, all the way? And then can you descend back down? So we're looking for coordination, but we're also looking for weakness. We know it's weak if you cannot squeeze around our finger, if you have a really weak squeeze around our finger, or if you squeeze and it lets go. So we may want to work on finding the pelvic floor muscles, aka kegels, if you can't do that contraction, if you don't have good coordination, if you're not getting the signal. Very rarely, even if you have tightness in the pelvic floor, weakness in the pelvic floor, very rarely are we going to prescribe kegels, because we have to find the root cause still. Is it coming from the rib cage? Is it coming from the rectal side? Is it coming from abdominal tension, jaw tension? Like, finding what's the contributing factor to the reason that the symptom is there, and then working on restoring, rewiring, and reworking the impairments that are contributing to that. So I hope that that brings some clarity around the difference between a tight pelvic floor and a weak pelvic floor, because the majority of the time people think that tightness means strength, but you actually, again, you will see a tight pelvic floor typically along with a weak pelvic floor. You don't always have a tight pelvic floor with a weak pelvic floor though. A weak pelvic floor can also have the inability to activate. You don't have great sensation too. So very important that you get your pelvic floor assessment in to determine, do you have any of these things going on? And if so, what's the plan to make it better? Drop any comments that you have below. Check us out on our website, but I look forward to hearing from you and answering any questions you may have.